All right, y'all. I hate to disrupt good conversation, especially at 8:30. It's great to see people are at least chatting and talking. But we'll get this session started. I'll say that it's hopefully going to be somewhat informal, so that, especially given the perfect size, so that we can have a really great and intimate conversation, so that there's plenty of time for questions and unpacking this. And hopefully you'll see one of the goals of this is to maybe create like some sort of collaborative network or just a group of people who are interested in this topic. I'm also realizing there's Zoom people, so I should probably speak into this. So kind of just like the run of show, what we'll be talking about today is I'll give a brief overview as to why we think this topic's important. Obviously, I think you also believe that, given that you're all here. Rick Johnston sends his regards. He's in a different session right now, but was able to record. And we have three really great speakers who are going to talk about their experiences with implementing the institutional WaSH insecurity experiences scales and some of the findings they found from that. And then we have Stephen, who will be discussing his experience with working with children directly and some other ways of measuring WaSH hygiene issues. And if we have time, we can have a fun agenda setting activity at the end. So to get into things, so I'm realizing I don't have an intro slide for myself, but my name's Josh. I am a professor in epidemiology and environmental health and within the new Center for Climate Change and Health Equity at the University at Buffalo. To make a quick plug for that, I'll say that we are maintaining our title of Center for Climate Change and Health Equity. And it's a truly transdisciplinary group of folks who are really interested in addressing some of the most pernicious problems that are going to come from climate change. And we currently have 3 postdoc openings within that center and then 4 more broadly within the whole department. So if you're interested, lots of stuff going on at Buffalo, lovely area, climate safe haven. Okay, anyway. Child and adolescence is a really critical window of development. And just so that we're all on the same page of what I mean by childhood and adolescence, there's a few different agencies with different definitions, but broadly understood as adolescence is a period of 10 to 24, 25 starts getting into adulthood, and then anybody younger than 10 is children, infants. But during this period it's marked by really rapid brain growth, so we want folks to have good nutrition and not be exposed to infectious disease so that their body can direct energy to that brain growth. But also this is where there's social interactions, school, other learning opportunities where people are gaining the skills and economic resources that will set them up for a lifetime of well-being. And this isn't just me thinking this and saying this. This is coming from, in 2016, there was a Lancet commission that was trying to highlight the importance of adolescence. So as an age group, so historically the development sector has focused a lot on this window of the first 1,000 days, so focused a lot on pregnant folks, and within that first 5 years of life, or 2 years, and then a lot of folks also do children under 5. And that's really important because that's one of the most vulnerable life stages. But this whole series is talking about that there's burgeoning adolescence in a lot of populations, and that it's a really critical intervention point where people are learning certain health behaviors that they will then carry on into adulthood. So this would be a great time to try to target and modify those. So the takeaway from the 2016 report was trying to be like, yes, we have climate change, yes, we have a burgeoning population of youth, but that doesn't have to be seen as a big problem. There's actually opportunity here. And they talk about this triple dividend for any of the economic folks in the room, of talking about how investment at this life stage has benefits both directly for the adolescents, the adults that they'll become, and also their potential children. So this is also about the time where people are coming into reproductive age and understanding the practices that they'll then pass on to their children as well. they just came out, just this year sometime, I don't actually know the date, but they came out with a new updated call, so almost a decade later, saying, yeah, so we haven't made the progress that we thought or were hoping that we could achieve. And they were also starting to point to and highlight, again, why this is such a critical population to be researching and working with and engaging with, given that in a lot of regions of the world, the proportion of the population that is going to be in this 10 to 24 window is only expected to increase. So quite, and like some quite large numbers, for instance, within Africa, almost half the population will be age 10 to 24 by 2100. So good group to start thinking about. But as I said, all things are not rosy and cheery, so to actually meet and achieve that triple dividend, we need to start addressing some of these really harmful and environmental stressors that potentially undermine child growth and well-being. So here they highlight climate change, the stressors that can come with urbanization and migration and conflict. And what I would argue is that what underlies all of this, or is affected by all of this, is water, sanitation, and hygiene. So climate change is going to affect water resources, the ability to access and benefit from those, and that obviously has direct consequences for people's ability to take care of themselves, including being able to have reduced risk of disease, better diets and growth. So if you have safe water and can implement safe hygiene practices, you can prepare safe foods, reduce the risk of disease, have more diverse diets. There's some great research coming out from folks at this conference and others that have explored how limited access to water is associated with greater sugar-sweetened beverage intake, greater intake of ultra-processed foods because you don't want to use water to boil or cook or prepare these foods. It's also important beyond the household setting and in schools, because if you have these resources at schools, folks are more likely to attend school, be able to concentrate on school because they're not thirsty or having to go to the bathroom. They feel like they have reliable services. And ultimately, it's just a matter of dignity and safety for promoting WaSH services among this age group. This is the last thing I'll say on this. I keep hammering this home, but we are off target for meeting WaSH goals, and specifically in this report, they were able to break out WaSH goals for this adolescent age group and looking at differences by among boys and girls, and just showing that the number of disability-adjusted life years due to poor WaSH has been declining. We have been making progress. That dotted line at the bottom, that's the goal that we were hoping for by 2030. We're off target. This has been hammered home by quite a few other people, but we're making progress, and I think that's exciting to see that there's declines, but I think we can do a lot more in the next few years to really see dramatic declines in this. So why are we all here? What am I hoping to get out of this? The first is to provide some evidence on what WaSH among this age group looks like, both in schools and at the household level, and with that also showing established methods and how we have been tracking this historically, and also some new tools that people may find of value to complement traditional supply side indicators with more experiential measures. And like I said at the top, hope everybody keeps the conversation going well beyond this side session. Okay, so now I'm going to try to finagle this. We got this to work earlier. Rick Johnston, turning it over to him for his perspectives and kind of like a historical overview of how the WHO and UNICEF joint monitoring program has historically monitored WaSH in schools. I think that will set up a nice contrast for some of these other new tools that we're developing.
Hi, this is Rick Johnston from the WHO UNICEF Joint Monitoring Program. I really wanted to be with you today in this session, but I got double booked. So instead, I'm going to share some recorded inputs on the past, present, and future of global monitoring of WaSH in schools. Back in 2011, UNICEF put out a WaSH in Schools monitoring package, and in the same year, the JMP convened a series of groups to plan for post-2015 WaSH targets building on the MDGs, but filling gaps. And by 2012, these groups were calling for monitoring basic WaSH in schools and healthcare facilities, and those proposals were published in 2014 and fed into the post-2015 planning. By 2015, UNICEF published a working paper with preliminary estimates for countries with available data on the emerging indicators from that 2011 WaSH in Schools monitoring package. And in 2016, the JMP convened a global consultation that established harmonized core indicators for monitoring the WaSH elements of SDG Target 4A. The JMP expert meeting report included SDG definitions of basic services and recommended core indicators to monitor the basic service levels. It was recognized that full realization of the human rights to education, safe water, and sanitation required going beyond the basic service levels, and a draft menu of advanced questions was included in these guidance, but there was insufficient evidence to support a harmonized priority list at the time. We visited several countries in East Asia and the Pacific region, Cambodia, Indonesia, Papua New Guinea, and did a desk review of data availability and feasibility to incorporate the core questions into national monitoring systems to support SDG progress tracking. And then the core and draft advanced questions agreed upon in 2016 were published with guidance in 2018 as core questions and indicators. In 2018, the Global Baseline Report was produced with estimates for 92, 101, and 81 countries, respectively, for basic drinking water, sanitation, and hygiene services in schools. And this report also included a chapter with examples of enhanced monitoring and advanced service levels organized by the criteria of the human rights to water and sanitation, accessibility, availability, quality, and acceptability. The next report in 2020 had a special chapter focused on COVID-19 with examples of monitoring associated critical WaSH in school services. In 2021, we published the methodology that we use to determine national, regional, and global estimates. And the 2022 JMP Progress Update had two thematic pullouts on disability-inclusive WaSH services and pandemic preparedness in schools with national monitoring examples. These included how countries were using data to make decisions and target resources, such as in Ecuador, where the Ministry of Education used a national rapid survey to target schools most in need of basic WaSH in schools to support school reopening during COVID. And last year, our 2024 Progress Update has special focus on menstrual health, highlighting 30 countries with nationally representative data related to at least one of the new priority indicators for monitoring girls' menstrual health and hygiene that have been published by the Global MHH Monitoring Group, which is now called AIM-HIGH. This report included national estimates on basic services for 138, 144, and 134 countries, respectively, for drinking water, sanitation, and hygiene. That's roughly a 50% increase in the number of countries with estimates and nearly 3 times the number of data sources compared to the baseline report. Since 2016, when those core questions were first published, including some draft advanced questions, the evidence and resource base has grown significantly. There are a lot of examples on this slide. Some of them are coming from UN agencies. You have UNICEF with guidance on monitoring disability inclusive WaSH. WHO has 2 different surveys about school-based health. We have the JMP and GLASS review of climate resilient WaSH indicators that I'm presenting on in another session right now. Also, the GLASS tool has been expanded to include data on WaSH in school system strengthening. Also, UNESCO is very active in this space. We see a lot of work also from research partners, Northwestern University and University of Buffalo working on the INWISE scales, London School of Hygiene and Tropical Medicine, and Stanford making reviews. There are also nationally led processes such as the three-star approach in the Philippines and other countries. So there are a lot of experiences that we can draw on now when we think about indicators that go beyond the basic service levels. And in fact, WHO and UNICEF are just now starting a desk review of emerging indicators and questions for advanced WaSH in school services that go beyond those basic indicators. Our hope and our plan is to build on that desk review, to hold an expert group meeting, maybe in August next year, to come to some kind of agreement about global priority indicators and questions. And I think this session can contribute to that. Also, if people in the room would like to be involved with this, just email us at info@washdata.org and we'll make sure that your experiences are reflected. And then hopefully by the May 2028 report, we'll be able to include some examples of data in the JMP progress update and to publish an update to that core questions guidance document that would include indicators, questions, and new guidance around expanded monitoring of WaSH in schools. So thanks again, and I'm sorry I can't be with you today, but I wish you all the best in this interesting session.
Let's give it up for everybody. For some in the room that may have been duplicative of a session that he gave this overview Monday morning, but I think it's always interesting to understand the context and how we think about and how we measure these things and how we've arrived at these measurements, since measurement is how we understand and conceptualize the issues at hand. So historically, it has been, these supply side indicators. Well, I didn't include in the slide is that you do have to hear from me for another like 5 minutes. So those tools are really great, and as Rick showed, it's been hard to even get some of those data, and there's been progress over the years to actually start to be able to get nationally representative data and including that basic set of indicators in other sort of monitoring programs, both some led by governments, others by UN agencies. And I think, as Rick nicely queued up, that they're looking to define what an advanced service level looks like. This is a good time to start thinking about how we can maybe broaden that view. And I say this and include this example to help illustrate that. So this would be, according to WHO standards, a basic sanitation service in that it is no gaps, lockable, the doors lock, they are gendered as aggregated, but what we don't know is if individuals actually feel safe accessing it. So think about that human rights framework Rick was talking about. Do people value it and feel safe accessing it? Is it considered safe and adequate? And ultimately, all of this drives whether the facility is actually used. And so thinking about sustainability of services, if we build something and people don't like it or it's not meeting their needs, it will just continue to fall into disrepair or disuse. And so all of the work we did in actually building those services aren't going to mean much because they're not translating to actual use. And people aren't going to want to invest in upkeep. Again, this is not my own work, but I thought this was a nice illustrative example of, again, to actually put a voice to this was a student in a separate project in Nepal. They were interviewing students about their experiences with WaSH, and this person, at their school would have had what was classified as a basic sanitation service, but she was sharing the school isn't always safe and clean, water's not available to the toilets, there's an expectation that students are hauling that, so that would be a missed experience, that there's this expectation that while the service is there, students have to put in some work to use it, and as a result, a lot of the students don't use it, and also just because of perceptions of disgust. So one of those several projects Rick flashed up of thinking about this is the Institutional WaSH Insecurity Experiences Project, part of the broader WISE scale family folks may be familiar with. If not, I'll just make a quick pitch of there's a set of tools now to measure water insecurity, so how people access and are able to use water at the household and individual levels. And John Brogan, who some of you may know, once heard us pitching at a meeting like this. I was like, that's really great, we love that, we're using those tools at Helvetas, can you do it for schools and healthcare facilities? And thus born this project. So this has been going on since about 2021, 2022, of thinking and cogitating on this, and now finally rubber has hit the road, some sort of metaphor there, of now we're moving forward and making progress on this. So the ultimate aim is to develop scales, so tools where we can ask people a set of items, a set of questions about their experiences and create some sort of summative score to be able to say, this is how severe the burden of WaSH insecurity is based on their lived experience. And hopefully these tools are comparable so that we can compare estimates across regions and also look at disparities within sites. So as I've alluded to, one of the shortcomings of the JMP indicators is that they are measured at the institutional level, but it doesn't allow us to start to disaggregate to look at whether there's differences in experiences among boys and girls, people with disabilities, or other characteristics that could lead to limited access. So hopefully those will come along so that we can start to better monitor and understand this more comprehensively and better design and tailor interventions to improve these conditions in schools. So what is WaSH security? So there's a very delayed manuscript, I owe some of you in this room, where we are seeking to define that and scanning the literature to think about all the different domains or topics that are included within WaSH security, and that includes water, sanitation, and hand hygiene, and bodily hygiene, but also menstrual hygiene. Environmental cleaning is more from the healthcare facility side, so what I haven't shared yet is that we're developing these tools both for schools and healthcare facilities. Environmental cleaning is a borrowed language from that. That's basically like more hygiene of surfaces where there's high touch and making sure that those are clean and safe, and also waste management. So how is actual waste in healthcare facilities separated, and at schools, how is it disposed of? Is it incinerated? Is it taken care of? Do people feel like it's a generally clean environment? So we have some surveys that we have designed and are now piloting for students and staff in schools, and we also have some for patients and staff in healthcare facilities of all sizes. From really rural clinics where people are just going in for a quick day to larger facilities with inpatient care. So you're maybe wondering, like, what are we actually asking people? So this is a set of some of the candidate items so you can get a flavor of what we're asking students. So in the water topic, we are asking people, how often in the past week did you feel thirsty at school but there's no safe water to drink? We have subsequent questions about, were you unable to concentrate on school activities? Felt like you could be harmed by your water? Questions about hygiene that get at more than just, is there soap and water available at it, but are people able to use it? There's been some interesting findings coming out of people talking about it might be there, but they're not allowed to leave the classroom to go use it, or they don't want to use it because they don't have time. And the other domain is also sanitation, so asking about whether they thought the toilet facility was disgusting. And there's a lot of other types of questions about feeling unsafe, that you could fall in, related to privacy. Try to be comprehensive in this. If you want, you can get most of the questions. There's a few because I couldn't fit them onto a one-page document. You can scan this and get a flavor of what we're asking students and staff. Let me know if it doesn't work. This goes to a Dropbox link, and if it doesn't, I also have printed copies for you to take and look at. But yeah, so you can start to see all of the items that we're asking people. So the NY study that a lot of folks are going to be presenting on, which I'm really excited to see the data and what people have discovered, to give you a sense of what the study design looks like for developing a scale. So there's more items than we would like to actually ask or include. It's way too long, we know that. So the process of scale development is one in which you create a whole list of items that you think are really good. You consult experts, they tell you how bad they are, you change them, revise them, and then you actually go and pilot them with people to know how are they performing and are they understood and are they measuring something meaningful. And so we're at that stage now where we've had some experts weigh in on the questions, revise them, and now we're very thankfully with a lot of really great partners able to pilot and test these. So we have multiple sites represented right now. So green check boxes mean data collection is complete and data analysis is underway. Most everybody is collecting in schools. Some are also doing healthcare facilities. Our partners who are implementing in Ghana are just doing healthcare facilities, but starting to get a lot of really great and interesting data. And also some other sites on the horizon, and hopefully you too could be included here. Your institution could be represented. We're looking to grow. And I'll include at the end of this presentation some additional ways to get involved with this work. But what we're doing is going out and doing cross-sectional surveys with about 200 students within a site, so that's maybe 10 to 15 students at 10 to 15 schools. And trying to ask students as young as 7 all the way up to however old. We found that the age of 7, people can understand the questions and have been able to respond to them. Much lower than that, there's evidence from the food security realm where maybe students aren't going to be able to answer those questions or think back and do a 1-week recall of their experiences. But folks are going out and they are asking in a small subset of like 10 people of like, what do you think of when you hear these questions? And we use that information to determine whether the tools need to be revised either because of a mistranslation or just like fundamentally the question isn't relevant to that site or it's not understood and requires like a local example to understand it better. Then we do the surveys with, as I said, like 200-ish students, and also pair those with school observations to get the more traditional supply side JMP indicators. So I'm excited to bring up Lambert from Virridy to share insights from one of the implementing sites. And I will be able to get this to work, I think. Let's see. Okay, sweet.
Well, thanks, Josh, for introducing this work. Good morning, everyone. My name is Lambert Mugao. I'm a East Africa Program Director for Virridy, Rwanda, and we're able to partner through this project, partner in piloting this in WaSH. And next few minutes, I'll use this outline to provide or give you our experiences in the field. So AMA's MESA, which is roughly translated safe drinking water, is a carbon finance program implemented by Virridy. We provide safe drinking water treatment technologies to schools, and also through the program we provide support through education and the training and maintenance of the technologies. Since we started, so we do a lot of data collections, so before, during, and after implementation. And so far, from the beginning of the program 2023, we have already baselined 650 schools, and of those, 500 have already met the criteria for inclusion for implementation, and already 391 schools have received the technologies, and also the continual support through maintenance and other support we provide. So on average, there are about 950 students per school, and also the 35 staff members per school. So kind of to give you the extent how large the school is. So kind of this typical water sources is found at these schools. In fact, like 74% of water sources are rainwater catchment systems, and 25% of those of water sources are connected to spring. Also, the one inclusion criteria for our schools, they are at least one of drinking water source have to test positive for non-zero E. coli. So that's kind of baseline water quality testing for those schools. As Josh, earlier this year, we were able to implement this tool in these schools. So after receiving clearance from ethics committees for the country, then we proceeded with cognitive interviews, as Josh mentioned, that to understand if the questions, the items we're implementing are able to capture the information that intended to, but also if the participant responded to these questions, so there's a consistent understanding of the question between the participant. After going through that also, the come to items we had kind of to revise, given the feedback from the respondent. After completing that work, then we completed the survey from 21 schools, and we were able to recruit like 557 respondents. So those are kind of the school I was talking about, 391 schools that have already received technologies. Out of those, they already represent the school were implementing this tool. So because of this water program, so we'll be focusing on this presentation, water aspect of WaSH, so we're not providing information from sanitation or hygiene. So on this, on the left we have a theme or item, like 6 of them, so which you can relate to the program, and we have like the percentage in terms of how the student experience these issues. So mostly you can see that above 70% of the respondents did not have experience any of the issues in the previous 4 weeks. But you can see we have a significant percentage or proportion of students who at least experienced this like many times or sometimes in the previous 4 weeks. So with this tool also you can disaggregate between girls and boys. I was kind of surprised. So through my experience, when you're interacting with the student, it seems like the girls had more information inside about the issues and the water sanitation, but the result when it came, I was surprised like the boys are kind of to have a greater percentage for all these items, to have a greater percentage for boys who experience these issues. Even though there's a kind of, the gap is not like that wide for most of the issues, but also for this thirsty and lack of concentration, so the gap is wide for boys. This kind of the top 4 problems that were reported from the respondent. One of the water shortages and interruptions. So I think this is understandable in a context where most water sources run the water catchment systems and the springs. So sometimes it's the variability and weather variability. You expect it when it doesn't rain. So when you're relying on those rainwater catchment system, you might not have water. So there was a kind of interruptions. Also, there's an unclean or inadequate toilets. So those are kind of top 4 issues that we identified from this implementing this tool. Also, this brings to these discussions as we saw earlier. So the kind of significant percentage of students who reported experiencing problems, like they were worried that said there won't be enough drinking water, or they reported being thirsty, even if they are kind of from school, which received like an intervention, like they are supposed to have like clean waters. So kind of, but at least you can see these two were able to capture some of the issues the experienced students were facing. And also, for one of the possible reasons, what I think, so when we start the programs, we provide the filters at the ratio of 1 filter per 100 students. You can see, imagine like 2 classrooms sharing 1 filter. So some students, so that's kind of 1 filter, kind of small number. So if like it requires some student to go into the next classroom to get the drinking water, so that can interrupt the classroom classes. So I think, but that might be one of the reasons. So we see students are worried, also they feel thirsty. So I think that one might be the reason. Also, you can see this percentage of students who report shortages or interruptions. Also, as I said, as also the context of rainwater catchment systems, so that might happen. There's some schools which rely only on rainwater catchment systems. If it doesn't rain, they don't have water. So I think there's interruption with climate change, the variability in the weather patterns. Sometimes you expect it when it doesn't rain. So I think that will be understandable. But also, as you see here, sometimes you provide infrastructure, but for instance, like at a school, just like something like a small, like a tap handle, if it's removed, infrastructure is there, water is there, but you can't use it just because the handle was removed. Yeah, it happens even if for instance, that's why for example for the program, we keep monitoring is if the filter are functional. If one of the issue we face, children move taps. If they move taps, they can't use the filter. The filter is idle, so you keep monitoring. So you call them, they call them, so you do the maintenance. So that's kind of small issues, but it can affect the whole services and the experience that we observe. Also, kind of there's challenges and the lesson we learned through the implementation of this pilot. So one of the issues Josh mentioned, like asking this question to young children. So under the crucial criteria moved like 7 years to 19. But what some of the observation we had, we were very young children, you ask questions, and by the time you're finishing reading the question, it doesn't seem to capture the concept, or even it doesn't even remember the question. So that's the issues that we faced. Also, as some respondents tended to provide favorable answers, like the children answer. Sometimes they'll get there's kind of in the school, or maybe what the headmaster think, those kind of stuff. Also, consenting children was kind of time-consuming process because we need to have a consent of their parent, the guardians. It took the parents 2 days because we go to school, describe their purposes of the study, also hand the consent to students, they can take it home, then explain the purpose and the objective of the activity. If the parents agree, then they would sign the consent. They return back the next day, and then we obtain the assent from the student before asking the questions. Those are some of the challenges they faced. Also, there's a value added of these tools, as I mentioned. So one of the aspect of issue that we face, that one of providing filter at a ratio of 1 for 100 students, but that kind of were not sufficient, and also this as an addition or added value this tool can provide. So you can see, you can report like this was not reported, so we don't have enough filters, but we report like we are worried, we don't have enough drinking water. They are reporting like we are thirsty. So that's one of the kind of you can get from insight from the student to increase the number of the filters. Actually, this summer we did exactly that. So we doubled the number of filters the students, so that each school has now their filters. Don't have to go to school to the next class to get the drinking water. So one of the kind of added value from implementing this. Also, one of the report from student experience, one of the recommendation or what they saw as a solution to this issue to kind of improve or increase their water availability. One of the recommendations they mentioned like to increase the number of tanks. So as a school, sometimes you go to school, they only rely on the rainwater catchment system, but they don't maybe have 2 or 3 tanks. So that's not sufficient for a school of about 1,000 students. So what also that we had received some of our partners kind of the request to support their ongoing effort to increase the number of tanks at the school. So one of the activities we are doing with our partners to increase the number of tanks at the school. And also, as we said, also those small, not small, like maintenance of infrastructure. So kind of how it's been for the WaSH, like maintenance of the infrastructure and the services, very key for the experience of the people or the students at the school. That's bringing me to the end of this presentation.
I just had a small clarifying question. That photo you showed with the tap had been removed, would that be considered permanent access to water? So you said that baseline data showed that like 80% of schools have permanent access to water. Would that be considered permanent access to water?
Yeah, when you ask the respondent, the headmaster, as representative of the school, they have permanent access year round. But so, as you may ask this today, but tomorrow someone moves the tap. So, sometimes you may have someone with the handle, the tap handle. So that person will be responsible to come and open just the water. Or when it's not around or the handle is rose, then there's a kind of experience where people they can't get access to water. Yeah.
Thanks.
Yeah.
My name's Chris, I'm from Splash. We were also a site partner. I guess big picture, when you got the findings and when Josh sent you the data, was anything surprising or did it verify kind of what you already thought you knew? Like, did it provide evidence for kind of things that you already thought were happening, or was there totally new findings there?
I think in both ways. So
Yeah.
one of the issues, one of the aspects I mentioned that we're providing number of the Helvetas student ratio. I was kind of expecting so that might be an issue, but when they put feeling thirsty and they are worried that drinking water will not be enough, I think it's kind of evidence there's an issue at the school, even if they have received technologies. So that's what I'm expecting. One surprise was like the boys reporting experiencing these issues. Like I was not expecting that. I was like, given the interaction we had in the schools, I was not expecting that. I was like, more maybe girls, they tend to have a more insight about the issues. Maybe I was expecting the girls to have a kind of this experience compared to boys. So I was not expecting that.
One more round of applause. And I'll let you know, we double, triple checked that coding. That is true, that was in that site, higher reporting. I'm excited, all the way from Addis, hiker, so thank you. And if you want, you can click here, or, yeah.
Thank you very much. Good morning. My name is Fakar and I'm from Splash, all the way from Addis Ababa, presenting on our experience with this particular study in Addis. So to just give you an update on what we do as Splash. Splash is a school WaSH organization focusing on this 5 different cascading components of WaSH words. The first one being safe water provision at all public schools within Addis Ababa, and Bahar Dar, another regional city, and also a hygiene component where we have been deploying child-friendly hand washing stations. Again, we have a behavior change component where we have hygiene education in terms of hand washing with soap and also proper use of infrastructures installed within school. We also have another component evolving around menstrual health, where we have been delivering menstrual health education and puberty education as well to children within school. And finally, we have a sanitation component where we have been providing an improved sanitation facilities or toilets within the public schools in Ethiopia, together with a good collaboration with the government of Ethiopia. So to date, as you can see here, we have reached around 854,000 students and staff through our implementation at 896 public schools in 3 cities and 2 countries, with all those addressing findings around the different cascading components of our work. And also in 2023, we have been collaborating with the London School of Hygiene and Tropical Medicine, where we have had a 17% reduction in respiratory illness finding at Splash intervention schools attributed to Splash's work in school program was recorded. Jos has said everything around the study design, but I wanted you to note that we have conducted this particular survey at 25 Splash intervention schools with all the objectives as mentioned by Josh. And as you can see here, we have Splash collecting many data as in routine monitoring around water availability, infrastructure, access and cost in the name of cause of water security or insecurity. And we also have been doing a lot of research and evaluations around consequences of water security, and this InWise survey was bridging the gap between these two. as in state of water insecurity or security. These are findings from our study. I know I'll be talking more around hygiene, particularly hand hygiene and menstrual hygiene, but I wanted to mention an interesting and proud finding of our work around clean water provision. And this study has also proven the fact that almost all students surveyed, out of 200, 196 of them reported that they didn't feel that drinking water at school could hurt or cause sickness. And SPLASH has been providing a water purification and treatment system as an installation of water filters. So this is a big deal for us. And going through hygiene, particularly in hand hygiene, this is a finding from this survey that we did at school. 15% of surveyed students reported insufficiency of water at the school to wash hands 3 or more times per week. And 38% mentioned that sometimes they don't get enough water to wash their hands. Again, when it comes to soap provision, more than 88% of the students surveyed reported that there is no enough soap available at school, and this result is consistent with the results that we have through our internal KPI monitoring system, as in the presence of soap indicators. So this study has proved the fact that what we do at school and what we measure is aligned with the findings from this particular study. So to overcome these issues, SPLASH has been doing a piloting effort in the name of soap drive. So soap drive means we have been trying to mobilize within schools each student to bring at least one soap during the beginning of each academic year. And these soaps were being stored at a store within school, and there will be a designated person pulling out the soaps and putting them into hand washing stations every time so that they can last throughout the year. We have tried our best, but this also has been falling forth lately due to a lot of factors, one of them being a commitment from the school management and parents complaining that they can't afford buying soap for students and such alike. So this is just to give you an overview on what we do as in soap drive. Again, when it comes to hand hygiene, 10% of students also didn't wash their hands even if they wanted to wash. And as you can see in the data, the correlation matrix shows a strong positive significant correlation between the variable unable to wash hands and absence of enough water from this particular study. All of what I have been talking has been aligned and aligning with the internal research and monitorings that we do, and this study has been confirming the findings that we have internally. And all of this is attributed to the fact that the different kind of level of gaps has been noticed, and any contributing factors that you may see over here, including lack of soap, and as Lambert said, moving taps. For us, we call it tap theft, and no designated person to restock soaps is also another key finding. The next thing that we assessed through this survey was around menstrual health. And for this group of people, we particularly purposely targeted students, grade 5 and above, girl students. And of the total surveyed students, 13% of menstruating girls said they feel nervous or embarrassed to come to school during their period. And in this study, there is no significant relationship between water availability and feeling nervousness or embarrassment to come to school while menstruating, while we did the analysis. We also have 14% of menstruating girls sometimes missing class because of they are having a period. And in the study, there is a positive correlation, as you can see, a p-value of 0.2. between feeling nervous and missing class during menstruation, and this is statistically significant as well. And we also have 54% of menstruating girls reporting that they sometimes or many times feel like they don't have a clean and safe space to replace menstrual materials or pads they used for their period. And also 26% of menstruating girls reporting having traveled to to privately dispose the used pads or menstrual materials. And 29% of menstruating girls also were mentioning that they are unable to wash after changing their menstrual materials at school, and this may be attributed to inconsistency of water availability within the schools throughout the week. So again, the findings from our menstrual health evaluation is aligned with the findings that we got from this particular study. As you can see, where only 14% of girls reported occasionally missing class. So following that, we tried to combine individual indicators and classify them into water, hygiene, sanitation, and MH teams. We have calculated WaSH insecurity prevalence among students, and as you can see, when it comes to water, nearly 1 in 4 students reported both worrying about having enough water, drinking water, and feeling thirsty at school in the past week. And when it comes to hygiene, more than half of students reported soap sufficiency or insufficiency to be a huge issue for them to wash their hands in the past week. And when it comes to sanitation, we have around 16% of students describing the toilet facilities as disgusting and said they were unable to concentrate in class because they needed to use the restroom but could not. And finally, when it comes to the menstrual health bit, among menstruating girls, only 7% of them reported not having enough menstrual materials at schools and missing school because of their period, which is a positive thing. So having this and triangulating it with the fact that we have a lot of routinely collected data and analysis, SPLASH has been concentrating on these factors and trying to do a lot of forward-looking activities by continuing to track our output and activities as we are directly responsible. We also are continuing and using impact and sustainable key performance indicators to measure our progress throughout the project implementation and beyond. We also are continuing to conduct hand-washing observations and self-reported image practices to see how we are doing with that. And we also are planning to begin using quality of life measures like the INWISE, the particular study that we did, and regular M&E processes named there. And finally, we also are planning to incorporate well-being measures like the WHO 5 standards into future impact evaluation research along with health measures. Thank you very much, and happy to
Thank you, Vika. That was a really great presentation. Clearly, SPLASH has been working really hard, so thanks. I'm Sarah Young, Northwestern University. I'm going to copy Chris's question and ask what's surprising and what's not surprising in the big picture of what you learned using these experiential measures.
Yeah, nothing was surprising for us because this has been confirming what we know already and what we have been struggling to overcome and to inject different aspects of solving the issues on the ground. So yeah, the soap presence has been a massive issue and persistent issue for us, which this study has revealed as well. MH-related indicators were also areas where we have been noticing some effects through our MH evaluation program. So most of the things were aligning, even though we only did the analysis on the students' data.
So if it's not surprising, is it useful? I mean, if you already knew it, then do you need to measure it?
Yeah, because as you can see, I have already presented selected indicators. There are many more questions. As Josh said, you already know the questions and the length of it. So we'd like to dig through a lot of that. And these are the key interesting factors that we thought that we know and would be useful to share for this audience. But there are a lot other helpful information that we got that we would like to dig through, and waiting to hear more from Josh.
I can elaborate a little bit, like as Fikr's colleague, I think we're actively now going to start thinking, like we already knew a lot of this because we've done like long, lengthy studies and we have really long monitoring approaches. And so moving forward as we move into new places, like what can we swap out and now just like replace with NYs to get that good enough information that has historically required like triangulation of studies and alignment of monitoring and so I think that's something that we are excited about with this tool is like becoming more efficient and more timely with that understanding so we can make better decisions quicker. Whereas now a lot of what she presented on Splash's previous stuff is like retrospective long studies, whereas having regular time scale or timely information would be great.
Okay, awesome, thanks.
Hi. Given that you have such promising findings, because that's what it looks like, has there any thought been given to scaling it up or working, I don't know if you work directly with the Ministry of Health or Sanitation, to actually make this an institution, like institutionalization, as opposed to just an intervention, not just anyone doing it, but
Yes,
go
maybe.
beyond the actual intervention.
Yes, maybe just to give you one particular example, we are currently working with the government of Ethiopia, particularly the education sector, and coming up with a circular to be disseminated across all schools, which particularly focus around water availability and soap presence. So this should be done through the government injecting a budget into the schools so that they can secure any kind of soap-related and pad-related items, as well as designated operation and maintenance people within the school so that they can maintain any infrastructural failures throughout the process. So this is a huge thing that we are currently working on. The circular has been drafted and only waiting one more signature to be up and running in the schools very soon. So yeah, we do a lot of other things as well with the government and other stakeholders as well to capture and improve the day-to-day works, given that we have implemented almost at every public schools within Addis Ababa and Boulder.
Okay.
Thank you.
Thank you. I also just want to keep saying all the great things about Splash. I learned recently that they have a really innovative and cool model of also working with the government, where the government is contributing funds and matching funds. So that's exciting. And also, as an organization, let me know if I'm getting this wrong, Chris, but 100% of schools and Addis you have coverage in. I mean, that's like wild.
And they're developing they have developed tamper-proof taps.
Yeah, tamper-proof taps, let's talk.
I sent Lambert a video from World
Yeah,
War.
really, I could not break the tap off. I'm like a 200-pound freak. So we'll talk more about that. Go to the Steve Washington book.
I'll talk for that. And now I'll bring up the lovely Christina. And also, just clarifying, yes, I didn't say this at the beginning. I asked folks to be thematic so that we all, you weren't getting overwhelmed. So we have had water, hygiene. Now we're going to be hearing about sanitation. And I also am saying this publicly now. Her slides got imported and they got a little wonky. So in advance, yes.
We'll see. Good morning, I'm Christina. I'm from Helvetas, but this work is also kind of part of the Swiss Water and Sanitation Consortium. So Helvetas is a Swiss org, but we are also part of the Swiss Water and Sanitation Consortium, which is, I think, about 6 or 8 different Swiss water organizations that all kind of have a similar mission, come together to do a lot of this work. And so this work around the Y scales and the NY scales is really supported by the consortium overall. I'll give a couple other caveats here. One, I am not a good replacement for my Nepali colleagues, so please forgive me that I don't have all the details, but we'll present a little bit on that. And then this is truly hot off the presses data, as in came in Tuesday. So I'm gonna present some early analysis here, and I got some preliminary insights from my Nepali colleagues, but you can help me process some of our findings, perhaps, in real time here. Cool. So just very quickly, this is 2 sites, 2 regions where where the NY skills were piloted. and one is in Cirquette and one is in Bardia. And I guess the quick note on this is just, because I'm going to present just the regional differences, is these are two different programs entirely. They're two different organizations. So as I mentioned, this is the consortium. So one of these sites is a Helvetas site, and one of them, I believe, a TDH site. And so in one area we worked with 5 schools, and then in an area it was 5 schools and also healthcare facilities. I'm not going to present the healthcare facilities data, but that was also kind of part of the work we did. I would say in general these implementations like do look very different in what they did, but generally we were talking about like infrastructure related sanitation projects. Yeah, I'm only going to talk about sanitation today. But like, for example, the Helvetas program is like a full, what we call like blue schools program, where we're doing water and sanitation and hygiene, but also some like climate related, like, and like more greening of schools type of work as well. Very quickly, we did about 200 interviews in each of the schools, 50 with staff, 150 with students, and Josh didn't really get into this when he was talking about it, but we do cognitive interviews on every site that we work, every new site that we work on. So everybody you just heard from also did a round of cognitive interviews. And just to emphasize again that these scales are in a pilot phase, so it's really important for us to be doing this like cognitive side of the work to start to be like, is this question even understood in this context? We really want these scales to work across all different contexts, all different countries, regions, and so it's really important that we start with that experience. And I think this is one of the more challenging parts, I think, of doing the new scales. The cognitive interviews take a little bit of time, but there's kind of a lot of learning that can come out of that, and we do a round of like, how can we refine even in that context a little bit, and there's been a lot of learning just from that like cognitive to actually doing the survey phase here. So just to get into this, so Lambert also presented some kind of, or no, he did girls and boys. So we'll start with those like students versus staff. And I guess I just want to pause for a minute on just kind of acknowledging kind of what kind of questions we're asking. Again, Josh did this really quickly, but I really do want to emphasize these are very different questions than what you're going to be looking at when you're talking about a joint monitoring program or your like regular infrastructure-based questions. So as we think about sanitation, sorry, this is like so small here, so I'm like having to like look at the screen. But the questions are really about, you know, safety, and are there enough materials in your school, like, and then there's like this side of like being ashamed, and so about your sanitation facilities, and then kind of the downstream, like, did this make it so you could not like concentrate on your school activities? So we are really talking about experiences of students and staff. And I think this is always, the students and staff surveys I think have been one of the more interesting things to take a look at. I think it affirms perhaps a lot of what we think, which is that staff in a lot of cases have better facilities than students. They feel like more secure in kind of what their facilities are. And we see kind of just a lot of that in this data. It's really affirmed. Josh and I were in a session earlier this week where we were really talking to a lot of folks about this kind of like staff versus student experience. And I think this is one of the things when we do like reflections back to schools, that's one of the more interesting things for staff, is they have a very particular experience with their facilities and don't totally recognize what's going on with like student facilities, and that they have less materials and that students feel less safe. It's a little bit more difficult. So I think these are really important findings for us to dig into more. This is by region, and I forgot to note which one, but like this is important. This is really interesting to know that we're seeing pretty large differences in water security between those two regions, and frankly 2 different interventions here. So as I mentioned, these are 2 different kind of organizations, 2 different interventions entirely. So there is a lot that we can glean here as far as it's the one in Virridy that's kind of the better numbers, where we can kind of see what interventions they're doing. Perhaps our interventions in Cirquette can kind of learn and listen to that. Again, I don't have a lot of good like granular data like this intervention's doing this, so we think it's better and that type of stuff, but it gives us some good kind of food for thought. as far as comparing different regions and data. And then finally, on gender, obviously, Lambert presented some different data around gender. I think for us, this is mixed as far as like girls and boys across the metrics. We're not totally seeing like one of the genders feeling, less secure or generally, but perhaps from our experience and what we heard, maybe a little bit more in line than with what we thought around like girls perhaps feeling more insecure, having a little bit more insights into what was going on there, but we did see like a lot more kind of like mixed gender for the Nepal case. And then I'll just give like some general lessons and insights. I think one, just to emphasize that the purpose of this whole exercise is just to pilot these. We're trying to figure out what we're gonna do with these scales. It's really amazing that we have these sites that we're working with where they're able to see a lot of really interesting results within the work that they're doing. But a lot of what I focused on here was the scales in general as we're continuing to iterate them. So the first thing is on enumeration, and I actually didn't list this here, but one of the things that we found from going from the household water security scales, which probably, I'm assuming most of you in this room have used, I assume, they're very popular, to putting these in institutions it is 10 times harder to work with students than it is at the household level. So our ethical approvals are way harder. Are just kind of navigating how to talk to students is much harder. You're gonna see a lot of, like, when you look at photos of this enumeration, it's like a kid sitting in a field with an enumerator, but like the teachers can see them. And so like it's a really hard navigation of working with students. Those of you who have done that, we won't talk about it, but healthcare facilities are then like 10 times harder than that because of working with patients. So I think there's a lot of learning, and perhaps, Josh and Sarah, when they agreed to do this for John Brogan, didn't realize that what they were getting themselves into of working in households versus institutions. So I think there's a lot of lessons kind of in the transferring, but also like I have a lot more respect for all of my colleagues that work in schools and healthcare facilities now. There was just, and because our staff is so experienced in the HYs and the household level indicators, they were surprised how much more training they had to do for the institution stuff. There's a lot more, the household, the HY scales only really deal with water, and we're now talking about water, sanitation, hygiene, menstrual hygiene, so there's a lot more categories. I think there's also different recall periods throughout some of the studies, especially with students versus staff. So that gets complicated, and I think, again, the training was just like a little bit more difficult. One of the things that really came out during this part of the WISE findings is we kept hearing from respondents that they were just like surprised we were kind of asking these questions, and they were like, wow, this is a really cool opportunity for me to just like share different experiences. Like normally someone is just asking me if we have a water on site, and this was like, I'm now getting to kind of talk a little bit more about how this works at this school, why we may or may not feel safe, etc. So it was there was like an appreciation for this like different side of sharing. Generally the survey, again, I presented just more of our sanitation stuff. The survey is really water heavy. And so I think it's something to think about as we move into rounds of this, if we really do want to be inclusive of like that entire water security scale that Josh put up at the beginning, like, do we need to temper our knowledge of water and move into those other sectors? And then I think this was just from earlier with appreciation, but this was just more of like just complete unexpected, like nobody's ever asked us these type of questions before. We've never know how to respond to these, and it's been just really interesting feedback kind of on that end. So I hope that was just a little bit of insight to kind of bring it all together. Cool, thanks. Yes, Dr. Young?
Thank you, Christina. I really appreciate feedback for everyone who's working on these questions should keep a WTF list. Really, this is too many water questions, the recall period. All of these critiques are super useful because we are scale developing, this is not the end product. So keep them coming. Mm-hmm. And I just wondered if you could give us one example of a story that people felt oh, here, let me tell you this, I wouldn't have otherwise brought it up.
I mean, I think one of the stories, I can't tell you like a particular story, but one of the things that came up a lot was girls just feeling like they couldn't use facilities at the schools because they felt like they were dirty or not like private. And so that just kept coming up as like, we don't want to use the facilities here, basically, was the end all on that, for sure. Anything, oh, thanks, Scott.
So you kind of mentioned that doing this kind of data collection in schools is much harder than doing household level data collection. And I think for a lot of NGOs, the prospect of even doing household level data collection is like a big undertaking and
Totally.
can, you know, sort of stretch you thin. So how do you think about that kind of difficulty of engaging in schools as like the trade-off between what you're learning versus what maybe like a Nepal program can handle across all of their work?
Absolutely. So I would say a couple of different things on that. So the first one is I'm excited for when the NY scales are shorter and like manageable in that way, because I think that's one of the big advantages of the HY scales is like they get at so many things with a 10 question or 12 questions. 12? Gosh, I really should know that one. So I think that's one of the things I really like about the Y scales in general is like instead of asking 10 questions just to figure out the quantity of water that people use, we're actually just asking them what we really want to know, which is like, does this work for you? Like, you know, like, do you have good experiences with water? The other thing that I think is interesting that came up in the session earlier this week was if we can just ask these questions at the household. So that might be something interesting that we also like perhaps think about, that I was like, what do we gain and lose from like, because one of the, again, with the ethics and all this stuff, like one of the big boundaries there is like, you have to get a parent's approval, right, to do that survey for a child. But if you're like in their house, like, does that take away, or, you know, is there some kind of efficiency perhaps there? So I don't know, just a couple things come up. Cool, thanks everyone.
Stole my little comment. I mean, it was like a revelation of like, yeah, wait, could we be asking students what school they go to and then asking the questions there, and then maybe minimizing also that feeling that a lot of students have expressed through the consent process. It's been like telling folks like, you will not be penalized for this, that your answers are private, and that like they only serve to benefit the school, because I think doing it in the school setting, students are like, am I allowed to say this? Like, it's not good. So we worked hard to make sure and try to get good answers, but yeah, that was a huge revelation. Okay, we've been talking a lot about whys. Rick got to talk about his JMP stuff, and I'm excited to turn it over to Stephen, who last year I got connected with him through the power of the UNC Water and Health Conference, and was really floored by all of his cool work working with students, or children, and I just am excited to hear about other alternative approaches than what we've presented here. So, Stephen. And wait, I need to get you. Okay, no, just kidding.
All right, well, thank you so much. So my name is Stephen Rue. I am a visiting assistant professor of medical anthropology from Miami University. And as was just introduced, so my research really looked at children's experiences with water insecurity. And today I'm really going to talk about some of my reflections with that, because I didn't only speak with students, I spoke, or children who are students, and I might have some insights to some of the questions that were just raised, but I also worked with their parents at the same time to get a comparative understanding of how children understood household water insecurity as well as their parents. So, without further ado, I'll kind of get into that. Now, just to preface, my research was really born out of this notion, which I'm now very happy to see we have more and more data on, that children were really not involved in any research on water insecurity. We're often cited as so important, so critical to protect, but very rarely do we have any actual insights, either just collected through interviews or systematically from children. And I worked with a group of 24 children in the city of Belém, Pará, Brazil, which is, many of you may be familiar with now, is going to be the next site of the UN climate meeting, which has actually had some very interesting implications for my field site and children I've worked with since I was there. But I worked with children about 5 to 10 years old, and we worked in locations known as baixadas, what would be normally called favelas in other areas of Brazil. These are low-lying, impoverished areas, and they have a long history of issues with water, not only interruptions and poor water service, but in particular flooding is a big issue here, and that played into my insights with water insecurity as we really got this understanding that it wasn't just about not having water at all, it was also about having an excess, which could really impact things. We did a few activities with children. I did a drawing activity, which is called Draw, Write, and Tell, or Draw and Tell in some situations, where children were asked to draw an image in response to a question. We also did more in-depth eco-cultural interviews that really followed children's daily routines and how they interacted with water throughout their daily routine. And we did the same thing with parents. The only thing we didn't do with parents was the actual drawing activity. That was unique to children. And what we really focused on was this local understanding of water insecurity, which were intermittent interruptions to water supply and variable quality within these areas. Because interestingly enough, actually most of these households, despite this impoverished setting, had regular access to piped water, but it would be very regularly shut off, and when it would come back on, it would often be dirty, there'd be low water pressure, there'd be sediment in it, and sometimes insects and parasites that we later hear on throughout with the children. And so one really important thing I'm going to highlight is the difference between speaking with adults and children, and actually the techniques we had to develop to actually do this research in a household with both adults and children at the same time, and often within the same rooms. Now, in particular to that, I wasn't alone, I had a team with me. This is my partner, Professora Mariana Ingles from the University of Sao Paulo. And we found very, very early on that it was very critical to have at least 2 of us at the interview at all times. One, because often what we'd do later is we would have to separate. I would either do an interview with an adult and Mari would do the interview with the child, or vice versa. Mostly because, one, we were limited on time visits. It was very hard for us to sometimes go back and schedule, because these Baixada areas were known to be dangerous, and we were somewhat limited in how long and where we could be at what times. But the other issue was that, of course, as many of us might think, parents, as just teachers, can have an influence on a child's response, right? Sometimes not even intentionally, but there'd be times that if they were in the same room and we had to interview one at a time, a parent would go, "Oh, wait, what? You didn't tell me about that, right? Or that's what you're doing?" And then, of course, that might embarrass the child, or they get a little sheepish about things. So we often had to try to do them one at a time or with separate interviews going on. The other reason we had to have 2 individuals was because children in these households often had younger siblings who would love to interject and try to interrupt us. And they were curious, right? One, they were curious because we were doing this interview in their household. One, they were curious because I was a white American, and many of them had not seen an American before, or even had spoken English with one. And we had an interesting situation where one of our children was actually called a liar at school and had to prove that he had met a white American. So part of it was to not only manage other children in the household, entertain them, let them do the drawing activity, but also we found that some children were more comfortable with Mari and some children were more comfortable with me. It really depended on that level of interaction. So sometimes one of us would drive the interview more heavily because that child just seemed to respond to us a little bit better. Now, what we would do in these cases is we had paper and crayons for them to work with, right? And our main question was, okay, tell me about something you do with water every day. Draw me an activity that you do every day with water, or draw me something that you think is very, very important with water. And we'd work and sit with the children, and they'd have 5, 10 minutes, 15, however long they wanted, to kind of draw out this scenario, right? An activity, something they thought very important with water, and we'd sit and we'd talk with them. And once they were done drawing and coloring, of course, we would launch into an investigation. Okay, what activity were they looking at? What activity did they represent? Did they write anything on the image? We would clarify what the image was about. We tried never to assume, simply because between a 5 and a 10-year-old, you had various levels of artistic ability, and some were more, detailed than others. And this could change wildly from a 10-year-old to a 5-year-old. It was not one that was more artistic than the other, but the level of effort would be different. And we would use this not only to make the children more comfortable with us, because immediately it was strange for them to we walk in, they've seen us a few times because we've been around these households for over a year on a larger project, but we've never spoken with the children directly. So it built rapport, it made them much more comfortable with us, and when we started launching into the larger interviews about what they were interested in, what they were doing, they had something concrete to point to, right? They could tell us about the image, we could ask questions off of that, as well as our standardized questions that we had for our interview. And if the child was very shy and didn't want to speak, we had another form of data that we could collect, right? We knew a solid piece that this is an activity they felt that they did or something they thought was important. One of the key differences that we find as we were doing this with the children and we were doing it with the adults is that one, the children, the drawing activity, they loved it. They loved it so very much. They often would come back and they'd have filled the book with images and with sometimes more things related to water, so we'd come back and the children would have more things to share with us. Other times they just loved the idea that they could keep these things and they could draw with them, and they very much liked this artistic element. And when they did these, they would tend to focus on the everyday activities that they went through, things that they did personally throughout their day, their routine. They didn't focus as much on family matters or household matters at large unless it was directly relevant to them, and I'll get into that in a little bit. Adults would tend to, when we do the interviews with them, focus much more broadly about the managing of the household. So this classic, mother is responsible for the water in the home. She's very conscious about what water needs they have, when they have water, when they don't have water. And those tended to be the larger themes that we would see as we differentiate them. Now, I've got a couple manuscripts forthcoming about all of this, so I won't go into too much details. I want to focus on the methodological implications that I think are very interesting and relevant to our discussion here. But these were some of the drawings that the children produced, and this was very exciting because these drawings, although they may look like drawings on the surface, they had an enormous amount of meaning. And in particular, this one up here in the top left corner for me, that one is incredibly important because that particular child embedded an enormous amount of emotional description in that image. Green was peace because you had to be calm when you didn't have water. Red was for heart because the water was about love and it helped nourish things. And actually orange, she told me this very directly, was about confusion because sometimes when you didn't have water, you were confused as to why you didn't have water. When it came to activities, basic hand washing and hygiene became very, very central to our conversation, and so that was a common depiction of engaging with water, drinking it throughout the day, and often the reason was it was based in enculturated practices of, well, if we drink water, we won't get sick. If we wash our hands, we won't get sick, we won't get a cold. And then many times, children would also connect it to the environment because water was not only central to their everyday realities, but these children would often travel into the interior of the country, further into the Amazon region. They'd spend time with family, and they were very, very conscious of being able to swim in the water and to engage in the rivers and the lakes of the Amazon. Because the water in Belém, there are many canals, and it's at the mouth of the Amazon River, so there's water almost everywhere, but it is highly contaminated. It is debris and rubbish everywhere on almost every step. They pull out entire houses and cars out of some of these canals. They're polluted with fecal matter and other human waste, and actually many of the surrounding waters have been known to have pharmaceutical contaminants in them as well. So it's very difficult for them to engage with natural bodies of water if it's not a contained body of water like a pool, which some children would. And the last thing I'll get onto quickly is how play also became very important in this because it was so hot in these environments. Children were very, very, very willing to play with water. They liked to play in water. And this came out with both in our interviews with mothers and children, that play was important for childhood, to explore and to be a part of it, and to play in water, but it was also very important to keep cool and clean. Now, drawings have been used many, many times with children. And they're very successful, particularly across the climate insecurity literature, if you take a look at that. Drawings, paintings have also been done with food insecurity, and there are a number of other methods that we can use to complement not only our scales, but qualitative interviews. You can do walk-along interviews where children will go along with a child and have them show things to you and explain. And some children almost did that with me as they walked through their household and would literally explain the different sources of water and how they used them and how they interacted with them. You can also do responses to known media, right? There were some studies done on climate where they'd show picture books that depicted images of climate change or image of the environment in general, and most often these include some representation of water, and then children would respond to that. What did they think? What did they feel? It gives the children something concrete to latch on to. The other thing you can do is photo elicitation or photo voice, which is a great method because very similar to the drawings, it gives you another form of data that's not verbally dependent, particularly if children are shy or are unable to understand the questions in the moment. Now, photo elicitation can be difficult because you have to be very mindful of your situation. We were actually going to use cameras in Belém, but because of security concerns, we actually decided very much against it. And then we found that the individual art and the element of being able to keep something physical, keep the pictures, was very important. So it's important when you think about digital media and how you want to use that with children in certain resource settings, to think about not only like the implications of giving a material object that a child might not be able to keep, but how other individuals in that environment may respond to the fact that there's a camera there. And now the last thing I want to highlight very quickly is that, because I know I don't want to take too much time, is that we found school became very, very important. And the question was, can you ask these questions in the home about school? Absolutely. It came up very naturally in our interviews, because throughout the day, these children, unlike many situations of water insecurity where there's water scarcity and children are involved in chores or collecting water, their responsibility, and this is largely part of government stipulations that really encourage them to go to school in Brazil, was to go to school. And so naturally, part of their routines, interactions with water would not only be at home, but interacting with the school. Many times children would bring water from home to school because the water supply was just as unreliable at the school. If they had concerns about water quality, it wasn't uncommon. They'd say, well, I don't know where the water at school comes from, or my professor is responsible for it, so I don't know what it's like. If they didn't have water at school and they didn't have a cup or they didn't bring a bottle, they would easily go without water at school as well. And other children told us many times about how they would share with water with friends, if there was any exchange of water or concern about cups. And this was also coming off the heels of COVID, actually, so there was still a little concern about germ spreading as well. So this bringing an individual cup to use for water or bringing a bottle of water became very, very important. And this just worked into their daily routine. And children around the world, if they're not prohibited from attending school, spend an enormous amount of time of their daily lives at school. So inevitably their interactions with water throughout the entire day are going to include not only the household setting, a school setting, and then any other institutional setting that they spend an enormous amount of time at. So I think moving forward, one thing we might all consider is that we measure at the household, at the institutional level, but in an entire day, a child is interacting with water at many points and in many places. And so when we think about what these indicators mean, whether they feel they have enough water or they have access to safe water, we might also need to think and break down where do they feel they have access to water and safe water. All right, and these are my acknowledgments because I had a wonderful team and support from NSF to do this research. I don't want to take up any more time, so thank you so much. I'll take any questions. Yes.
Thank you, Steven. That was a really cool presentation. Bless those kids. Just a quick clarification. You said security concerns over cameras. Does that mean security over the cameras being stolen, or of people having their photos taken?
Both. It was easy. You could easily have been, if someone's saw you walking around with the camera, you could have been a target. And we were afraid that if we took pictures in an environment, like particularly we wanted to document the infrastructure in the area, it would make some people unsettled.
Okay.
So we were careful to not use, we were careful about the cameras as it was. And I was even careful about using my phone to document and record just the environment because we were afraid it would be either we'd be a target for people trying to steal from us, or it would make some of the local unsavory characters a little wary of us.
Got it.
I guess I have a question. So I know you have some papers coming, but like you talked a lot about the methods, but like when you do look across 25 different interviews with kids, like what is like a theme related to insecurity that really stood out in that kind of in that broader analysis that was surprising? Maybe let's frame the kind of surprising.
Perhaps so one of the big things was that play became incredibly important, and I think that ultimately was environmental, simply because the heat made it so important to either stay cool during the evenings because of a bathing or shower, or just to play during the day because it's easily 98 degrees, 100% humidity in Belém. And so when these interruptions would happen, if someone couldn't sleep at night, or if someone couldn't shower at night, they'd be uncomfortable, they couldn't get good rest. Or if they couldn't bathe in the morning, they'd be dirty before they went to school. The other thing that was interesting is there wasn't a lot of emphasis on feeling thirsty in this environment, which is perhaps somewhat surprising, but that was because there was a very strong emphasis on households always maintaining drinking water. And they would go to very great lengths to always buy drinking water from the local supermarkets or from local vendors. So the children were never particularly concerned with thirst, but they were concerned with bathing and hygiene.
All right, well, let me wrap us up and let you all go to the next thing. Thank you, Stephen. Don't go yet before you can scan this amazing QR code, everybody. Okay, just as I suspected, not enough time for any of this. Okay, let me flash through them. If you are interested in, so lots of methods. I think Stephen would be happy to talk. Rick would be happy to talk more about the JMP indicators. But if you're also interested in piloting or using the InWise tool, scan this. It's a pretty, the website is under development. Please ignore the stock images and know that what's the most important thing there is the contact us page. If you want to get involved with this work, come talk to me afterwards. We have lots of resources available, both in terms of the surveys, ethical approvals, and methods of collecting the data. Like I said, we have a website. So we are seeking partners. We had that list of sites where we want this to be truly global. So working both in the United States and other contexts. We have only one country in Latin America right now. It'd be obviously great to have a lot more, North Africa, Middle East, more Asian countries, so that we can see if these questions hold up across all those regions. There you go, that's where we currently are. And final bit is just many people to thank for this project. Most of them, a lot of them are in this room, but also many others not currently represented, so I just want to thank them, our funders, including Hilton Foundation, Swiss Water and Sanitation Consortium, AVOG, Splash, and PATH, and other people who've contributed a lot of hours and time into this. So I'll end that there. There was an activity, but not important. So if you want the questions, come talk to me. Otherwise, thank you for listening and good questions.
Josh, could we have a photo with all the people on the... Yeah.
Come on up, InWise people, and see them. Include Scott, get on up here.
Yeah.
Scott, you got off easy on this one.
You want one of these? Oh. Oh. Come, friends. We're taking a photo. An InWise photo. Is the light going to be a thing?
I was going to say, should we...
Josh, can you take the picture?
Yeah.